Hello everyone. Today we're diving into the topic of causes and risk factors of cervical cancer. This is a crucial subject that can help us understand what leads to this condition, so we can focus our efforts on prevention and early detection. So why does a woman get cervical cancer? Well, it doesn't happen overnight. It's usually the result of long-term changes in the cervical cells. Most often it's triggered by persistent infections or lifestyle factors. Understanding what these are and being aware of them is the first step towards prevention. Now let's look at some of the key causes and risk factors. Number 1. Human papillomavirus infection. You might have heard of HPV before. It's very common. And while most HPV infections clear up on their own, some can stick around and cause problems. We're talking about high-risk strains of HPV here, particularly types 16 and 18. Which are responsible for about 70% of cervical cancers worldwide. Now, how does this virus cause cancer? Well, when you're infected with high-risk HPV, the virus enters your cervical cells and integrates its genetic material into yours. Over time, this disrupts the normal cell cycle and can lead to abnormal cell growth and eventually cervical cancer if it's not cleared by the immune system and left untreated. Number 2, early sexual activity and multiple partners. Let's talk about sexual activity. Now, engaging in sexual activity at a young age or having multiple sexual partners raises the risk of exposure to HPV. This is because these activities increase the likelihood of coming into contact with someone who might have the virus without knowing it. And remember, HPV is usually spread through skin-to-skin contact during sexual activity, and it can be transmitted even when there are no visible signs or symptoms. 3. Smoking. Yeah, we know smoking is bad for you. There's loads of research showing how it increases the risk of various cancers. So, what does it do exactly? Well, tobacco smoke contains lots of carcinogens, which are substances that can cause cancer. These carcinogens can weaken your immune system, making it harder for your body to fight off infections like HPV. Also, studies show that women who smoke are about twice as likely to develop cervical cancer compared to non-smokers. Number 4, a weakened immune system. Your immune system is your body's defense against infections and diseases. When it's weakened, your body becomes more vulnerable to infections that might otherwise be easily fought off. So, what can weaken your immune system? Certain conditions like HIV/AIDS can severely weaken the immune system, making it difficult for your body to clear HPV infections. Also, people who take immunosuppressive drugs, like those who've had an organ transplant and are taking drugs to prevent rejection of the new organ, also have a higher risk. Number 5, long-term use of birth control pills. It's important to note that using birth control pills is generally a very safe and effective way to prevent unintended pregnancies. However, some studies have suggested that using oral contraceptives for more than 5 years may slightly increase the risk of cervical cancer, especially when combined with other risk factors such as smoking or a history of sexually transmitted infections. It's thought that the longer you use hormonal contraception, the more time your cervical cells have to undergo changes that could lead to precancerous or cancerous growths. Number 6, multiple full-term pregnancies. Here's another interesting one. Having multiple pregnancies, particularly at a young age, has been linked with a higher risk of cervical cancer. It's thought that hormonal changes and increased exposure to human papillomavirus, HPV, due to multiple pregnancies might play a role. And finally, number 7, family history of cervical cancer. If a close relative, like a mother or sister, has had cervical cancer, your chances of developing it are higher. This could be due to shared genetic or lifestyle factors. So there you have it, the causes and risk factors of cervical cancer. The number 1 preventable cause is HPV infection. That's why getting the HPV vaccine if you haven't already, and having regular pap smears and HPV screenings are so important. Other things that can lower your risk include avoiding smoking, practicing safe sex, and maintaining a strong immune system. Remember, knowledge is power. The more you understand about cervical cancer, the better you can protect yourself and seek early treatment if needed. Until next time, stay healthy and stay informed. And if you found this video helpful, please share it with someone who might need it.